what is it that pushes Indians towards heart disease? And we're all reading news about young Indians getting affected by heart disease. To answer your questions today, I have with me leading experts of the country. I have Dr. Ashok Seth, who's a chairperson of the Fortis Escorts Heart Institute. You know, there are many unique features of heart disease in Indians that are talked about. So is the overall risk really higher in Indians? Or is it just one of those things that is talked about?
So let me just put it into a very important perspective. There's no question that the risk of coronary artery disease in Indians is high. In fact, it is clearly all across the world being documented. And when I say all across the world, I also mean in Indians living in the United States, and Indians living in UK, Indians living in Singapore, and Indians living in West Indies, that the risk of coronary artery disease is 2 to 3 times higher than the West. What is not clear is, and it can be 6 times higher than the Chinese and 20 times more than Japanese. We certainly are the heart attack capital of the world. That is also well recognized. Even in the West, there are more heart attacks occurring in the Indians than compared to the local population. What is not clear is whether this is related to just the higher incidence of risk factors, like the metabolic factors of diabetes, hypertension, and metabolic syndrome, or is it truly genetic, is not very well understood. There are, in fact, indicators when one would say that even corrected for the diabetes and hypertension in the population, in the population of United Kingdom, in the population of even Singapore, and even in the population of West Indies, who've been actually living for generations in that area, who've changed their lifestyle according to local, there is still an increased risk. So yes, we think that there is a genetic predisposition, but this other issue is there's no doubt that there's an increase in risk factors. And that increase in risk factors is not just metabolic, not just diabetes, hypertension,
something more.
But there is something more than that. Yes.
And it translates into more serious disease?
It does translate.
One is just minor heart attacks? Or,
yes, so. It translates, is that again is a difficult question to answer. Does it translate into more serious disease? But yes, there are greater number of deaths. And while the deaths from heart attacks in India is increased by 2 to 3 times over the last 40 years, last 30 years, I would say.
1990 onwards.
That's right, 1990 onwards. Yeah. It has actually decreased in the West. Now, that could be due to multiple factors, including care, etc., including the type of disease. But given diabetes and hypertension, given the smoking and obesity, we have more diffuse disease. We actually have much more disabling disease. And certainly in regional areas, it's been well demonstrated, and in the South, that is fairly diffuse disease. And we see that from many parts of the country as well. So yes, we have, I would say, put it as we have more serious disease, we have more extensive disease processes, and we certainly have smaller coronary arteries, and therefore we certainly need to take more precautions for this. So there is a whole variation for Indian coronary artery disease compared to the Western coronary artery disease.
So quite clearly, we are at greater risk of heart attacks. The incidence
given to God by changing the lifestyle.
Add on to what Balveer is saying, or Dr. Balveer Singh said, is also the fact that yes, it's the commonest cause of death in women in India as well. That's, again, an important thing to realize, 6 times commoner than the breast cancer. The second aspect is that we in India are getting heart attacks 10 years earlier than the West. So yes, our younger people are getting more prone to heart attacks. And certainly 25% of our heart attacks are happening in age less than 40, which is practically unheard of in the West. So we are definitely becoming a very important, it's getting very important for our young people to understand, not to get scared, but to also understand that we are prone to have coronary artery disease with heart attacks, and that we've got to do everything to prevent heart attacks at a young age.
Even in the younger age.
That's right.
All this about, I see these patients, these young patients sometimes who go to gyms and take supplements I don't understand, and they walk like that. And some of them, and of course, we deal with the hormonal issues, and they have a lot of hormonal issues. After they stop their supplements, there's a big challenge in managing their lives. But I've also seen, and my cardiology colleagues tell me, that some of them, get unexpected heart disease and heart attacks, and they find very funny-looking hearts when they sort of try to intervene. So what is your feel about that?
Right. No. And yes, before I answer that, I'd also like to sort of augment what Dr. Karthikeyan said. very important message his was that he said fatalistic. What he means is inevitable. I don't think everybody in India, just because an Indian should feel it's inevitable कि heart disease होनी ही है, तो हमारी तो किस्मत में लिखा है. Actually, that's right. Prevention and getting the risk factors together could change a lot of that. So I think that is a very important message to augment. It's not inevitable. It's just not, you can't, आपकी किस्मत में नहीं लिखा है. It's actually still in your hands to prevent heart disease. This important aspect you said about exercising. There's nothing wrong with firstly, of course, let's get this exercise issue again correct.
So we'll come back to the exercise in detail.
Okay, so you wanted to about the gyms? About the gyms?
The gym and the hormones.
Okay. See, gymming, there's nothing wrong with gymming.
Yes.
In fact, gradually, one should actually, gymming has all sorts of exercises, and it could be a combination of aerobic and anaerobic exercises. So we'll get to exercises later. But I think whatever artificial you take for increasing endurances, building up muscles, and actually getting your physique in order. And these are usually very damaging hormones and steroids, and even products. They could be very high increased level of proteins. All of those are known at unnatural levels to be able to damage both your heart, your muscles, your body, your kidneys. And I think there is nothing there which actually should make you actually take those. So very clearly the message is absolutely no. Every form of exercise is good provided you graduate to it, and both anaerobic and aerobic can actually help you, and gymming is not a bad thing at all, provided you stay away from.
It's the stuff you take along with that.
You stay away from any artificial products which are supposed to build your body up or muscles up and so on and so forth. They're harmful. They're clearly
harmful.
harmful.
Really harmful for hormones as will bring it down, the bad cholesterol. So, Dr. Seth, I'll come to you with another major area here, and that is hypertension. And hypertension, as you know, is even more common in India than diabetes. What's the role of hypertension as a risk factor in all this?
The role of hypertension is very important in multiple ways. But first thing very important to understand is the silent killer. Now 25%, maybe 25% of the Indian population does suffer from hypertension. I mean, when we do routine checkups, and this was one of the CSI studies where routine checkups was done across, on a World Heart Day, across the nation, and more than 1.5 lakh people were examined routinely at bus stops, at railway stations, etc. 25% turned out to have. Well, that you may call that a casual reading. You may call that.
But
that's
true that
it just puts things into perspective. That it does exist. It's a silent killer, and it's become a most important, should we say, our target for control if we got to control the health of this nation, because hypertension is not just a risk factor for coronary artery disease and an important risk factor. It is so for strokes, for renal dysfunction, for kidneys, in fact, for any form of peripheral vascular disease. So it's one of the most important killers. In fact, it is actually the one to be modified along with diabetes, the two important aspects to be modified in this country, right from the grassroots levels. So that's the first part. The second part is that hypertension can be controlled by natural methods also. And I think that's so important. So it's a lifestyle disorder also. While in younger individuals, it may have certain pathological basis. It can happen from kidney disorders. It can happen with other endocrine disorders. But we talk about those in a very young age. When we talk about the majority of the Indian population, around 40 and above, this is all hypertension, which is lifestyle modulated. And for example, just even exercising daily and losing weight will drop the high blood pressure on average by 10 millimeters of mercury. Now, 10 millimeters of mercury decreases the risk of heart attack immediately, dramatically. So I would say that hypertension needs, everybody in this country should at least measure their blood pressure regularly and occasionally. Now they can do it themselves, or they can just go to a general practitioner. But because it's a silent killer, it becomes a responsibility right down to the grassroots levels and the villages, even for our social health workers to be measuring blood pressure. And by the way, high blood pressure measurement and sugar measurement become a part of our community medicine itself. So yes, this is one of the important things to take care of, and I would urge everybody to be sure, at least understand what their blood pressure reading is, And if it is high, take every effort to control it, firstly by natural methods, if it's mildly raised, and we talk about mildly raised when it's over 150, over 90, but if it's anything beyond 160, you start needing to get to medical measures, and that means getting down to a doctor and making sure that you monitor your blood pressure to get it under control. Now, every time we talk about, and I must urge this again, we have these conversations around what we have to advise to the public versus an individual. Now, we don't want every public to actually be, but I would say every person in the public should know his blood pressure reading. At least beyond the age of 30, should know at least once what his blood pressure reading is, whether that's measured by himself, by an instrument, or by anybody else. And if it's nice, once a year he should measure his blood pressure, know his reading. Of course, if elevated, he would actually just measure it more. And when we talk about a checkup, actually, a checkup should only be a checkup of risk factor profile, to tell you frankly.
Absolutely.
And nothing else is needed in a checkup. And that checkup can be done even by a healthcare worker, because all we need to know is, do you have sugar and do you have diabetes? Do you have hypertension? All we're talking about is silent killers.
Correct.
बाकी तो being overweight, smoking, etc. You know it yourself. वो तो दिखेगा सामने.
ये जो blood pressure, diabetes, ये मालूम नहीं पड़ता.
ये तो मालूम नहीं पड़ती. And that's what we're talking
करना
about.
बहुत ज़रूरी है.
बहुत ज़रूरी है. And इसको check करा लेना या खुद check कर लेना बहुत ज़रूरी है.
So, think. Dr. Seth, we already talked about this. One line about, do women have different symptoms?
Just, before we move away from the risk factors, I think it's very important to emphasize to everyone that family history of heart disease or dying, somebody, father or mother, dying less than age 60 is a very important aspect. किसी भाई बहन, father, mother की young age पे अगर bypass surgery हो या stents जले हो, blockages हैं, very important history. And I emphasize that again and again, that it's a multiplication of risk factors. So if there's a family history, and then yesterday I had a 32-year-old gentleman who was smoking and said, I'm 32, I've done nothing wrong, and why do I have a 90% blockage? And I said, what was wrong with you? You were smoking and you had a family history. That makes you 9 times, not just 1 + 1 is 2. Right. It makes you 9 times more susceptible to having coronary artery disease. Right. And had you had hypertension, you'd be 18 times more susceptible to having coronary artery disease. So we must remember, to control of risk factors is meant because these are multiplying your chances of having heart disease.